We heard just today from Dr. Randall Williams at the State Health Department that there is still just the one case of the UK variant that has been isolated in Marion County, Missouri, but that doesn't mean it'll stay there. So the first question, I guess, is because it is on so many people's minds, Dr. El Budo touched on it in the story, is the vaccine good for multiple strains of this virus? Dr. Haight?
So there are many variants that you may have heard about. The UK is one, and the vaccines appear to be very effective against the UK variant. There's also the South African as well as the Brazil, and those are being studied about how effective the vaccines are. Depending on the variant, it is thought that the vaccine, if not as effective as it is against the UK and our current variant, it will still be very effective to help these others as well. But again, they're being studied right now.
So those are the variants we know about, and it occurs to me that a lot of people are probably looking at this the same way they look at influenza, that every year you go and get a shot. There are a couple of different strains identified for that particular shot that year. You hope they have guessed right, and you hope that you are protected from influenza. Is that what we can expect going forward with this coronavirus vaccine, that there will be new strains and new shots, and it might be a guessing game going forward?
One of the reasons that it is maybe even less of a concern is actually the kind of platform that the vaccine is built on. So the mRNA is actually a really simple process that we know when the genetic variants occur, we can use the new genetic code to build a slightly different version of the vaccine. So even though it's concerning that the virus continues to change, that's what viruses do. And this type of vaccine platform might actually be really well suited to keep up with that and to be able to change to better match the variants as they occur. That might mean booster doses. I think it's too soon to tell. But we do know that the vaccine, as it is right now, produces a really sophisticated immunity, and there's multiple places on that spike protein that we're responding to. So even when one piece of the spike protein changes with one of these variants, the vaccine is causing immunity for many places on that protein. And so those are not going to become ineffective just because of one change or even two or three. So it still is a really positive outlook here.
Dr. Haight, again, this idea that this is going to be a regular thing, we should get used to the idea that we will go every year and get a shot.
Again, as Dr. Morris said, it's a possibility, but again, it's a little bit too soon to tell. As we are studying the different variants and the vaccine response, we'll know more as we go on in the future. However, as Dr. Morris also said, the platform that the Pfizer and the Moderna are on, as well as the possible vaccines in the future, they are very adaptable, and so if boosters are needed in the future, these vaccines appear to be able to make those changes and be able to alter enough so that we are able to vaccine against the new variants if needed.
It's going to be important then to have vaccinations against fighting the mutant strains and then stopping them from happening. That's our roadblock to those strains?
Yes, it is a roadblock, and vaccination is a very important part. But I would also like to remind people, if you are sick and feel like you're sick from COVID or even the flu, to really stay home, take care of yourself, contact your physician, make sure we're doing all of the things that we've recommended during this time period, because I will let you know that the number of flu cases is dramatically down just with everything that we've been doing for COVID. So it's a combination of vaccine and then taking care of yourself and making sure that when you're sick, you stay home and not infect other people as well.
Dr. Morris, couple of things that have occurred to me along the way. We are not being tested before we get this shot. We are told that for every one person walking around who knows that they have this virus, there might be 2 or 3 or 5 or more who don't. If I go and I get a shot and I'm positive and don't know it, is that shot going to do me any good? Am I wasting a dose of the vaccine?
Nope, you're absolutely not wasting a dose of the vaccine. I think this has really highlighted the importance of knowing more about the immune system and how it works and how it's boosted by different exposures. So by all means, we think that getting a vaccine is the safest way to build your immunity. But if you have natural immunity from having had a COVID infection and you're boosted by another exposure to that protein with the vaccine, your immune system is going to have a second strong reaction and a strong response to protect you from getting infected again. So it's not harmful, it still is protective.
And let me ask you, Doctor, about herd immunity. We have heard this term almost from the beginning. I have heard that it could come by the end of the year if we get everybody vaccinated. I've also heard that it might be 2025 before there is this thing called herd immunity to protect the rest of us. Explain what it is and when it gets achieved.
Well, I really hope it doesn't take until 2025 to achieve herd immunity, but I can understand with the pace of vaccination why it feels like it's going slower. Herd immunity is an important concept because that's when there are enough people protected in the community that the virus can't spread as easily or can't spread at all. I think we have some really good examples from vaccines in the past, things like polio and measles that really just don't happen and don't spread because everyone's vaccinated. If there is a virus that gets out and there's an infection, then usually the buck stops here because the virus can't bounce around. The number of people that we need to achieve herd immunity isn't really clear. It has to do with several factors, including how easy it is to pass the virus around and how effective the vaccine is. So this is a really effective vaccine. We've started off really strong with a great product that can help protect us. And it looks like the COVID virus can spread more easily than we thought. And that's why there are more people who have had asymptomatic infection. The numbers that we've seen have ranged anywhere from maybe 70, 80, even sometimes 90% of the population will need to be immune so we can achieve herd immunity. And obviously, to get there, we're going to have to pick up the pace of vaccination, and everyone is going to have to take a vaccine who's eligible to do that.